Well, a warm welcome to today's talk and update. It's Sunday evening, the 28th of March. Some brief news from the UK and the US. Then we want to focus on Brazil and South America, where things really are quite concerning. And we'll finish off with a report from Australia. So straight down to the UK. Number of cases in the last 24 hours. Newly diagnosed cases, 3,862. That's the number for the week, which of course evens out the fluctuations from day to day. And overall, that's down 1.7%. Now, deaths in the last 24 hours, 19. Still 19 deaths, but it's a remarkably low figure compared to what we have been getting. The number for the deaths in the week, past 7 days, 437. Still gives us a rather large number of deaths, an appallingly large number of deaths, 126,539, but the deaths are down 31%. And we can see that the deaths are down so clearly on this graphic here. And one of the main reasons that the deaths are down, of course, is because the high-risk groups are now vaccinated, therefore prevented from dying. They are being protected from serious disease, hospitalisations and deaths. And likewise, hospitalisations are going down. Now, there were still 343 patients admitted in the past 24 hours, so it's not gone away. But 4,560 patients in hospital. Again, the trend is a good one. And largely to thank the vaccination programme protecting all these vulnerable individuals. People vaccinated up to and including the 27th of March up till Saturday. First dose now over 30 million, second dose 3.5 million. So this is very encouraging for the United Kingdom. And in fact, there's going to be some slight release of restrictions tomorrow. In fact, we'll just have a look at it. We are kind of following this on this. We've got this roadmap here. So we're on step one, and we're on step one. We're on part two of that. So as of tomorrow, outdoor gatherings with 6 people and 2 households are allowed, including private gardens, and outdoor sports allowed. So you can have your friends round into your garden for a barbecue and a couple of beers, even though it's still a bit cold. Right, moving on to the United States now. Now, just go into the second screen there for the States. Trends in the number of COVID-19 deaths from the States going down slower than in the UK. But if we look at cases in the States as well, so daily trend in numbers of COVID-19 cases in the United States reported to CDC, a slight upturn. Now, we had been expecting an upturn in the United States in March. We've been expecting this for some weeks now because of the new variants. Even though these new variants are not well tracked, it has to be said, by the Centers for Disease Control because of poor genomic testing in the States. We had been expecting this effect, but it's smaller than we had been expected. We'd been expecting a larger turn up in the States. It's encouragingly small and it's regionalised as well. And again, a lot of this is to do with the vaccination programme in the States going so well. So cases in the United States, 71,000, slight upturn. This is the past 24 hours, so that's definitely an upturn. 421,000 in the past 7 days. Centers for Disease Control doesn't say over 30 million yet. It says 29 million and quite a few, but we know that the real numbers as of Sunday today are over the 30 million mark of officially diagnosed cases. And the deaths not falling as quickly in the States. Deaths now up to 545,273, another 1,283 deaths in the past 24 hours. So these are going to start falling soon, but they're not falling quickly. Vaccination in the States, what can you say, going really well. Over 91,000 first dose, second dose 50,000. So that is encouraging. The vaccinations and the new variants are currently still neck and neck in the States, but the vaccinations could well win and we'll see a small increase in cases late March, potentially into early April, but I believe it will be small. Now, I'm going to show you I think I'll start off with some graphics which shows why we're so worried about Brazil and South America at the moment. So, new daily new confirmed COVID-19 cases per million people. Now, I've left the United States on here as a reference, and we see Colombia's got less confirmed cases. This is a relatively short-term graphic here from January through to March. But then we see Peru is higher, Chile is higher, Brazil is higher, and Uruguay is, I'm afraid it's just taking off. So as we see those numbers compared to the United States, of course the United States has been coming down. These countries, all these South American countries, going dramatically up, largely because of the Brazilian variant, of course, the P1 variant. New confirmed cases of COVID-19 per million. Brazil, bad enough, but Uruguay, how long can that go on for? It's quite an alarming increase. Yep. Is that what's that one? New confirmed cases per million. Yes, it's duplicate. Was that previous one? Oh, yeah, they're both confirmed cases. That's okay. Right, Brazil and the United States. Again, we see the United States going down. Now, this is newly confirmed COVID-19 deaths per million. And the reason we're so concerned about this increase in cases is already in Brazil, as we see, the deaths are rising alarmingly, and the deaths in Brazil per capita are already higher than they were at the peak in the United States. So more people dying in Brazil now than at the peak in the United States, and the trajectory appears to be up the way. So let's look at that in a little more detail. Brazil population 213 million, well over 3,000 deaths per day now. This chap here is an emergency ward nurse. We're in the trenches here fighting a war, so the staff obviously clearly really feeling the strain. Now, this P1 variant, or the P1 strain, now in over 20 countries. It originated perhaps in Manaus in Brazil, in the Amazon. So the P1 variant almost certainly originated there. The reason we think it originated there is it's hard to tell where particular variants originated, but the testing in Brazil is fairly limited, and it was discovered in Manaus even with limited testing, so it could well be where it originated. Now, Manaus is a bit of an industrial hub. It's on the truck route, so the infection's been carried all over. This P1 is now the most prevalent in Brazil, and it was found in New York last week, which clearly is a concern and is part of the reason we're concerned about increasing cases in the States. We know the most common variant in the States, the variant of concern, is the UK one. But the Brazilian one is also present. Quite how prevalent is not yet clear. Now, some reports are saying that this P1 variant is up to 2.2 times more contagious, up to 61 times more able to reinfect people. Now, what this means is it's almost 2/3 more likely to cause reinfection than re-exposure to the old type of virus. Now, having said that, it still doesn't mean that people are likely to get infected. It's just more likely. It's 61% more likely than the old variant to cause reinfection. But of course, the old variant wasn't that likely to reinfect. But there is an increased risk, but very much more contagious from person to person. Now, whether there's an increased mortality with it or not, we don't really know yet. It could be, but the data on that is not yet clear, so we won't comment on that until we are much clearer about the data. Now, Porto Alegre, city in the south, P1 variant there is at least 60% of cases now. Hospitals report to be overwhelmed. Doctors are reporting younger patients. Doctors report fitter patients getting sick. Now, this is at the level of doctors reporting. We haven't got firm data on this, but there are reports from various places, and it's not just in Brazil, that younger people are getting sick and people without comorbidities are getting sick as well. So this is a concern, and of course we're worried about this carrying on its spread around the world. Just so important to get people vaccinated to get we believe, good levels of protection, but more on that in a minute. Deaths in Brazil. Now, this is a Wall Street Journal analysis, taking original data and analysing it. Now, the first wave in Brazil, under 60s, previous peak, 26% of deaths were under 60. And even although this P1 variant is still becoming more prevalent, as we've said, we think about 60% of cases now, already under 60s in this peak are 30% of deaths. So we see an increase of 4% in deaths in the under 60s already, and that may continue to rise as the P1 increases in prevalence throughout Brazil. And we'll just remind ourselves there of the deaths in Brazil. Daily new confirmed COVID-19 deaths per million in Brazil going up rapidly, and unfortunately will probably continue to do so for some time. We don't know for how long. Intensive care doctor says this: we're seeing patients who aren't obese, who have no comorbidities, who are not old, but even so the virus just overwhelms them. So again, this is anecdotal, but it's coming from several parts of Brazil and other parts of the world that this is happening. So the problems, well, the risk to the US is widespread complacency in the US. It is that it's widespread. Brazil, fully vaccinated 1.9%, so much slower than we'd hoped. And some epidemiologists are saying that the P1 mutation could actually mutate again. So there could be further mutations to the already very mutated P1 variant. I think from memory there's about 10 amino acid changes in the P1 variant in the spike protein. So that could potentially carry on mutating and increase transmissibility, increase reinfections, and potentially, we don't know yet, but increase deaths, and potentially infect younger people and people without the comorbidities. There's no question this is a concern. Frustrating that the data is not better than this, but these anecdotal reports are now starting to build up into a bit of a case, I'm afraid. Harvard, William Hangen, Harvard epidemiologist. There is a rush to declare that the pandemic is over, and it's not. Presumably, mostly talking about the States, so it is not. I dread to think what will happen when P1 manages to get to places that are not likely to get vaccinated for quite some time. So he's particularly worried about places that are not going to be vaccinated for some time. They are open to this P1 variant, which seems to be ravaging South America at the moment. Most daily cases per capita ever in Uruguay, Brazil, Chile, Peru, Colombia, as we saw on the first graphic that we looked at there. These are the highest levels they've been in these countries. Worse than the previous waves. This foundation here is based in Rio de Janeiro. If we don't stop the virus circulating, it won't stop evolving. So the risk, therefore, more severe forms. And the variant is spreading, we believe, to all these other countries. But Peru, where they have some genomic testing, it's 40% of the variants already. Therefore, that will increase. There's no question that will increase in percentage. Now, what about, to put it quite frankly, what about us in countries where we're having some vaccines? Is the vaccine going to be efficacious against the P1 variant? Well, the studies on this are only preliminary, but the answer seems to be yes. Now, whereas with the old variant, the efficacy might have been 90%, with the P1 variant, the efficacy might be down to 80%, roughly. I mean, we don't know those figures. They're not in yet. So, yes, it should give us protection. Probably reduced efficacy against getting the infection, But still, what we believe, all the data is showing so far for all of the vaccines in common use in Europe, the UK and the United States, is that even with this P1 variant, the vaccines we're getting now are very likely to protect us against severe disease and hospitalisation and indeed death. So renewed urgency for vaccinations. And we talked in the other day about India with nearly 1.4 billion people and the opportunity for mutants to arise there, which are arising. It just shows how we need the vaccines as quickly as we can, because unvaccinated populations means the virus will replicate. And as we saw in that specialised video yesterday, the day before, yesterday I think, areas where the virus is replicating, the virus will mutate. So globally, we need coordinated action. Let's hope that happens soon. So I'm just going to kind of sign off this section with that graphic, comparing it to the United States. There gives us a bit of context, and it's not where we'd like it to be. Okay, I'm going to finish with Dr. Susan Oliver reporting from Australia, and there is several guest appearances from her dog, Julie.
This is Susan from Australia with another COVID update. Now, I was actually thinking I wouldn't be doing an update today because there wasn't really a lot happening, but then suddenly there was. And Julie, that's Julie, my dog, by the way. Now, last week I spoke too soon when I said it looked like the 2 local cases that we'd had in Australia were now under control. It turns out that unfortunately in Brisbane, there has now been some community spread from the local case, which was the doctor. And what is more concerning is that they don't actually know how the spread occurred. So they had identified 900 close contacts of the doctor who had been infected. Every single one of them had tested negative, and everyone was feeling fairly confident that it was under control. But then this new case turned up with absolutely no link, hadn't been to any of the same venues. So what that means is there's at least one other case out in the community that also has had the virus. Now, since the one case was identified, there had been a subsequent case was also identified, which was a close contact. And suddenly last night it was all over the news that this person, after being told to self-isolate, actually instead hosted a party for 25 people. And I was planning on talking about that and being very outraged, as you'd expect, but then suddenly, just about 10 minutes ago, it's been on the news that it wasn't true. They never had a party with 25 people. Maybe there were 5 people there, but most of them lived in the house anyway. So no one knows where the story came from. Apparently it came from the actual person, but somewhere along the line there's been a miscommunication. So at this stage, there's been 3 more cases identified in Queensland that are what's considered community transmission. That is a case that's been acquired locally, but also in the community as opposed to directly from quarantine. One of the cases is actually negative at the moment, but they've picked it up from serology, and it's actually the brother of one of the other cases. But at this stage, no one knows where they're coming from, and that is a little bit concerning. And the 2 cases that are positive are the B117 variant, which, as we know, is more infectious and transmits more easily. We don't know about the negative case because, of course, you can't do genome sequencing when the virus is gone. Now, there's been a reaction to what's happening in Brisbane from the other states. A lot of states sort of imposing some restrictions on people from Queensland. WA is asking everyone from Queensland to self-isolate for 14 days. We're taking a slightly more lenient approach in New South Wales. We're only saying for people who've actually been in one of the exposure sites that they have to isolate. But the most ridiculous reaction has to go to Victoria. So the original case was first announced on Friday morning, and I think people may have even known about it on Thursday night. So in Victoria, they waited till Friday night, and then in the middle of a football game in Victoria, they suddenly announced that everyone who had been in Queensland for the last 2 weeks had to leave the ground. And so suddenly all these people got up, walked past everyone else, potentially having the virus, and left the ground. Like, what were they thinking? Surely they could have either just announced it prior to the start of the game, just told people not to go, or maybe just waited till the end of the game, since there's no use bolting the door after the horses bolted, or closing the gate after the horses bolted. But that's what they did. Anyway, on to better news. Our vaccine campaign is sort of running along, and we've now had over 500,000 vaccinations, which is double what it was last week. So still low numbers. The population of Australia is about 25 million. And interestingly, the population of Australia is currently decreasing. I probably won't be able to talk about more of that because I'm running out of time again. Anyway, a lot of people have been saying, they should be doing more to get more vaccinations today. We should be using stadiums, blah, blah, blah. The issue is we don't have vaccine supply. So clearly getting a lot of people into stadiums isn't going to help because there's no vaccines to give them. We're sort of handing out all vaccines we have, and that is now the local supply. Still nothing more out of Europe, which is really disappointing for Papua New Guinea, because we really were hoping they would give us the 1 million vaccines so we could at least start vaccinating people in Papua New Guinea. We have been supplying some local vaccines to Papua New Guinea, but fairly low numbers at the moment. So I'll run out of time again. So please stay safe, everyone. Thank you. This is Susan from Australia with another COVID update. Now,
Susan, you would be allowed 6 or 7 minutes, but thank you for that. You had me going there with a party of 25. I think someone was attention seeking there. It does sound a bit like that. Just wondering if these community cases are separate ones. Be interesting to see what the genomics is on that, to see if they are all the exact same clone of the virus or just one mutation apart from that original one. And good to see that vaccines are starting there. And of course, it won't be long until the vaccine production in Melbourne really ramps up, and we're expecting 50 million vaccines to be produced there. And again, we notice with sadness the difficult situation in Papua New Guinea, and the real pity that people there aren't being vaccinated. So thank you for that, Susan. Great update. Do take 6 or 7 minutes next time. And good to have a guest appearance from Julie. And thank you, everyone, for watching this update.